And here is your question. There are one more slides after this. So once you have read, please let me know.
Okay. Okay, we can
Move
move
to
to
next.
the next slide. Okay.
Yes.
Okay, we can start.
Okay. Right. So if you have read and understood, considering the communication skill station, kindly please begin.
Good morning. This is Mohammed Shirbini, the ST1 in charge. I'm working for Mr. X. I'm calling to I'm calling to speak to Mr. X to refer a case with a patient, a trauma patient to him with wide time on X-ray. Could I confirm that I'm talking to Mr. X?
Yes. Who is the consultant of this case, please?
Okay. Regarding the patient note, it's Mr. X, the consultant of the case.
Okay, summarize your case, please.
Okay. Today we
Okay,
have
summarize your case, please.
Today we have this gentleman who is 23 years old, presented to A&E department after motorcycle RTA. By clinical examination, the patient and assessing the vital signs of the patient, showing tachycardic on 120, and the patient is hypotensive on 100 over 80. The patient also has a swollen left leg, and his blood revealed a hemoglobin level of 8 and pH of 7.32. And the patient is also having a low bicarb over 90, and the patient is known to be diabetic. Some imaging, we performed some imaging for the patient in the form of chest X-ray, which revealed widened mediastinum and bilateral pleural effusion, for which chest drain was inserted in the right side. We couldn't perform CT scan because the CT machine out of service for the next 3 days. We have also performed abdominal X-ray, which revealed no psoas shadow, and X-ray of his left thigh revealed shaft fracture, left shaft fracture. We started resuscitation of the patient by giving him 4 liters of crystalloids and observed for 6 and cross-matched 6 units of blood, but not transfused yet.
Okay. What will you do for the cervical spine?
Okay, according to ATLS protocol, cervical spine should be supported by hard neck collar and sandbags and tape.
Okay. And what will you do for the leg?
I should stabilize the fracture by Thomas splinting.
Okay. What will you do for the blood pressure?
Actually, we started fluid resuscitation by 4 liters of crystalloid. I will follow fluid resuscitation and continuously monitoring the vitals of the patient for the fear of rising the blood pressure, not to increase the hemorrhage.
Okay. Why having metabolic acidosis?
Actually, the patient is having a closed fraction of the shaft femur, which may develop compartmental syndrome. Also, the patient is diabetic, and he may develop diabetic ketoacidosis due to stress of the trauma, and definitely hemorrhagic shock.
Okay. What about the abdomen?
The abdominal X-ray showed absent psoas shadow, which indicates the presence of erythroperitoneal collection, which may require exploratory laparotomy. If the patient clinical signs deteriorating, so he may need exploration for that.
Okay, and who will accompany the case?
I will combine the case with one of the anesthesia or ITU colleagues because the patient may need endotracheal intubation if the saturation dropped.
Okay, and what do you think is the most important finding and most urgent finding that you have?
Till now, I think the widened mediastinum in X-ray is the most important finding in the investigation. For that, we refer the patient for your care because widened mediastinum may indicate the presence of rupture aorta.
Okay, and what is the management of rupture aorta?
It will require repair either through open repair, through thoracostomy, or thoracoscopic repair.
Okay, and what type of how will you accompany the case towards me?
Actually, I need an ambulance which is occupied by resuscitation equipment for further deterioration of the patient vitals, and the presence of invasive maneuver for preserve the airway of the patient in the form of endotracheal intubation.
Okay, can you tell me what is the GSS of this patient?
It's 14. Yes, 14.
Okay, and what is the first thing you did for the open fracture and the bleeding from the fracture site?
Actually, there is no there is no wounds in the patient. There is, but I fixed, I stabilized the fracture by using his Thomas splint for the fear of neurovascular injury. I managed the patient according to ATLS protocol for adequate airway and breathing and circulation. After the stabilization of the patient, I start fluid resuscitation.
Okay, and what type of shock do you suggest the patient has?
Due to the swelling over the fracture, the patient might have hypovolemic shock.
Okay, and what is the grade of the shock?
Okay, according to hypotension and hypotension, grade 2, according to blood. According to the heart rate, it is grade 2.
Okay.
Why is patient undergoing metabolic acidosis?
Metabolic
Yes,
acidosis due to compartment
I-
syndrome.
he
Compartment
did
syndrome of the
he did answer it.
Yes.
He did answer. Okay, sorry.
Yes.
No problem.
Okay, and what will you do for the retroperitoneal collection?
Till now, it's observation. I'll continuously follow the vital signs of the patient. I do a serial abdominal examination and arrange for ultrasound. This will be arranged after referral of the patient. If the patient is deteriorating or the general condition of the patient deteriorating or dropped in the vital signs or show any signs of peritonism, so it may require emergent exploratory laparotomy.
Okay. And how will you resuscitate the patient exactly?
I will start by fluid challenge by giving the patient 20 milliliter per kg or giving him 1 liter of crystalloid over 1 hour and continuously monitoring the vital sign of the patient.
How
Why?
often?
What?
Continuously monitoring patients' vitals. How often? How frequently?
Actually, in this case, I have to monitor the patient while till transferring him to the cardiothoracic surgeon. But if he is in the ward, I have to monitor his vitals for overnight.
Okay, last time you told me that patient's hemoglobin was 8. What was the last time you did the blood labs?
I have we actually cross-matched 6 units of blood, but haven't transfused. So if the patient is not responding to fluid resuscitation, I have to consider blood transfusion.
Yes, but what was the last time you did the labs, blood labs?
Actually, it was when the patient came to the A&Es
Okay.
report. Mhm.
All right. Do you have any more questions, consultant?
No, thanks. You can
Oh,
transfer the case.
yes, good. Few seconds left, but of more time. All right, good, very good.
Mhm.
Right. Okay, very good. Any questions?
No, thanks.
Good, thank you. I